Okay, briefly, let's talk about salt. Most of the withdrawal symptoms that you experience on a low-carb diet, especially the ones that bother you early on, are related to water loss. But water loss in the human body is never about pure water. It's about salt water. Our sweat is salty, so is our urine. So when you want to hydrate your body, the best way to hydrate is with salt. If you've ever been hydrated at a hospital, you may have noticed that your IV fluid is salt water. Putting plain water in your veins would kill you. Though it may take a little longer, oral hydration is just as good as IV hydration. A drinkable saltwater formulation was what the original scientists behind Gatorade were working on. And what they discovered is that salt water is the best way to hydrate you. What they didn't count on is that nobody likes drinking salt water. Gatorade didn't become popular until Pepsi bought the formula and dumped in a bunch of sugar. While we're here to learn that you don't need all the extra sugar, you actually do need the salt. And right now you're losing salt in a lot of ways. So adding back some salt in your day is going to make you feel a lot better because it's going to help you hydrate. This message may sound confusing, especially coming from a doctor. So many of us are told to avoid salt, especially those of us who have high blood pressure. But this is in large part because of how much salt is contained in manufactured foods. On a low-carb diet, when you're cutting out manufactured foods to avoid the sugar, you're often cutting out a large amount of salt as well. And here's something you need to know as a low-carb eater. While cutting out salt can reduce your blood pressure by 5 or 10 points, cutting out sugar can reduce it by 20 points or more. That means often within days, I'm taking people off of their high blood pressure medicines. And yes, these people no longer need to be cutting the salt out of their diet. Cutting the sugar out does more. If you're somebody who has been reducing salt in your diet for a long time because of high blood pressure, I need you to keep an eye on that. If you're experiencing a large amount of withdrawal symptoms, it may be that you need to add the salt back. This may be especially true if you're beginning to have signs of low blood pressure, like dizziness. Check your blood pressure and hold off on taking your meds if you're in the normal or low range. You can contact me or contact your doctor if you have questions about needing to drop your medications. No matter what withdrawal symptom is plaguing you right now, a little water, a little salt, and a little movement is sure to cure it. I recommend having 2 different types of salt in your life. White table salt, which is simply sodium chloride, also contains iodine. Iodine is an important essential, and if you don't like seafood, then you need to get your iodine from your salt. I generally use the white salt for cooking. When I add salt into food or drink, I use the pink salt. This can be Himalayan salt or Redmond salt. Refined white salt contains only 2 minerals, sodium and chloride. The pink salts contain 60 to 80 minerals, contributing to many more of your essentials. Don't get tricked into buying some expensive electrolyte formula. Electrolytes is just a fancy word for salt. Simply adding regular salt into your diet will do. I start my day by adding salt to my coffee. Salt takes away the bitterness. You can try it. I very often add salt to my food. I don't purchase low salt foods on purpose. And whenever I'm feeling dehydrated, I just add a teaspoon of chicken broth base into a cup of warm water and drink it. Even better, I drink my own homemade bone broth. You'll see that in the app today, and I left you the recipe in your workbook. A healthy body needs a minimum of about 2,000 milligrams of sodium each day. But be careful, this is about 5 grams of salt. For reference, a teaspoon of table salt contains about 2,300 milligrams. 1 teaspoon brings you into the appropriate range for the day. 1 chicken bouillon cube contains about 1,000 milligrams. A half cup of low-carb tomato sauce, about 400 milligrams. And 1 dill pickle spear, about 200 milligrams. This sounds like a lot to keep track of, and it is. I would pay more attention to how you feel. While too much salt can make your blood pressure too high, too little salt can cause nausea, dizziness, confusion, headaches, and fatigue. These sound like your withdrawal symptoms, right? So my simple recommendation for you is put some salt into your diet. Don't be afraid to add it. If you're concerned about your blood pressure, keep an eye on it. But more than likely, it's lower than it's been in a decade, just from cutting the sugar.